Pain is a warning signal. The body will send you the signal, but the brain decides how loud it will get it. When you are scared to move, your body goes into protection mode. But in long term, your back gets only stiffer and weaker.
What about I cannot say it. Spondylolisthesis.
Spondylolisthesis.
Should I rest or be in bed until the pain goes away?
No rest.
Never.
Never. If you go to Google and then you start to Google, Google explains very well, but
It doesn't fit always.
No. Welcome to GNL, Real Life No Gloss. I'm Dr. George.
And I'm Lena, and I'm a surgical nurse. And you and me will work together in the hospital and in real life. And today's topic will be about what, George?
Today we will discuss about low back pain. Last week I met a woman in my private practice which had lower back pain around 7 weeks. We got a referral from the general practitioner after the MRI. Of course, the woman came to us after 7 weeks post-pain. The woman, she was fine, but she was a little bit in panic mode because they ordered an MRI around 3 weeks after the pain stopped, and she didn't know what exactly the report said. But I tried to explain that you don't have pain, you feel well.
Okay.
The report doesn't really matter, but I will explain you all these strange medical words.
Okay. Okay, so let's talk about back pain, what it actually is and what happens. Can you tell me a little bit?
Yes, but first I will suggest to start with the red flags.
Which are they?
Red flags: if you have fever with back pain, if you have a history of cancer and new back pain, unexplained weight loss, major trauma recently, new bladder or bowel problems, progressive weakness or numbness on the groin or saddle area, I think it's good to speak with your doctor.
So if you feel any of these red flag symptoms, please be in touch with your doctor. And if no red flags, what now?
Now we will explain the typical back pain, the kind of the pain that most people get at some point.
Quick note, this podcast is educational only and not a personal medical advice. We can start with the basic, George. Tell us a little bit, what is pain?
Pain is a warning signal. Pain officially is an unpleasant sensory or emotional experience associated with actual or potential damage. It's both physical and emotional. It's like the body will send you the signal, but the brain decides how loud it will get it. It's like a smoke alarm. Yeah. It can start screaming even if you have just burned the toast.
So that means that pain isn't always like a damage in the body?
Exactly. It's the alarm and the actual danger are two completely different things. They are connected, of course, but they are different things.
But what counts as a back pain or a lower back pain?
Lower back pains, it's the pain that you have from the bottom of your ribs to the top of your buttocks. Sometimes can stay only in that area, sometimes can travel down to the leg. It's like belt line area to be easy for you.
How common is this?
Extremely common. Basically, think that 4 in 10 adults, they have back pain in the last 3 months, or they will report back pain in the last 3 months. Most people will have at least one episode in their lifetime. I have it almost every week, but I try.
Despite you're a surgeon, orthopedic surgeon.
Yeah, but even we get pains. That,
Of course.
Like,
It's heavy surgeries. I don't blame.
it's not only the surgeries, it's, the life, but we will explain all the causes.
If I put a question like this, how long until people feel better from a back pain?
I think that most of them, they can be improved around to 2 to 6 weeks. Usually in the start can go faster, the recovery, but after the progress goes slower. About 1 to 3 people, they will get another episode within 1 year.
So we're thinking weeks and not years.
Exactly.
And it can come back?
Of course. The main problem is that you know that it will come back. It's very important to have a goal to make each flare less intense and less frequency. Because of that, we will explain what happens and why it happens to make it easier to deal with this.
So why does this even happen? We start there.
The reasons usually are mixed. We call it biopsychosocial. It's your body, your mind, and your life that plays a role. You cannot have one. It's usually all of these things together.
Okay, we can break it down in layers, but we start with the body. Please explain a bit further.
Okay, well, when we start with the body, that means we don't have a specific reason. It's usually, like lifting, sitting too long, poor posture, being out of shape. It's all of these things which can lead to irritate the joints, the muscles, the discs. So it doesn't mean that, okay, I have a low back pain and everything it's torn or out of place. It can be tissue irritation.
What about if the pain goes down, all the way down to the leg?
Then we are talking about the nerve, like it's called sciatic.
Explain.
When you have this, when the nerve is irritated, you get this sharp or burning pain. Sometimes you can have numbness or weakness. It's the nerve that gets irritated, and according or which nerve it will get irritated, in which level we call it, you will have a specific area in your body that you will get the pain.
When is the good time to order an MRI?
Officially, we order an MRI after 6 weeks. Usually it will not change something. We will discuss about it. But if you don't have any red flags, that is very important, we are waiting because the treatment is the same. If we see that we have like extreme pain that progress with a lower weakness, then we can make it faster. But everything depends on the patient.
What do you usually find in those MRI?
Usually in those MRIs we will see some disc bulges, herniations. Those two things are the most common. You have spinal stenosis, you can have spondylolisthesis, are less common but also important. And of course, in very rare cases, you can see infections, fracture, or even cancer.
Let's break down the discs. What is a bulge?
Think of the disc, it's like a jelly donut.
Okay.
This sits between two bones. In the center, it's soft. The outside, it's usually tough. Over time, the center dries. This is called the dehydration in our language. Mm-hmm. So the center dries out and the outer ring can get some small cracks. And those cracks usually are coming because of the use. We bend, we lift, we twist, we are sitting. Basically, we are living. So when the outer ring weakness, the disc can push outward. Sometimes it can press the nerve, sometimes it does nothing. But you can have them like in the report.
So it's like wear and tear, not a bad movement.
Exactly. It's like as we use our body, it has some damages. And of course, you can see like genetics, age, repeated load, smoking, body weight, all of this play a role. And if you think it is like age plus use story, like I just get older and I get some damages.
Can you explain the difference between bulge and herniation?
The difference between the bulge and the herniation, we discuss what is the bulge. With the bulge, the outer ring, it's usually intact. It's just pushed out. When we are talking about the herniation, the inner material, this that is in the middle, breaks through the outer ring and usually can press direct the nerve.
Yes.
So it's like escapes out, think that something comes out from the door and push the nerve.
And do all the herniation need a surgery, or how do you think?
I think that the most herniations, syringe cover the time. Of course, we give like painkillers and rehabilitation. And because of that, usually we are waiting, even with the screening.
What about stenosis? Explain a little bit.
When we are talking about stenosis, that means that the space where the nerves travel have become a little bit narrower. Over the year, the joints, they can develop arthritis, the ligaments can thicken, bones push, that they grow, and the disc, they can lose the height, like with dehydrations. All of that slowly can crowd the canal. So things that become, you have the channel that becomes like smaller in that area. And usually it's age-related.
So correct me if I am wrong, it's a slow narrowing over the time and not something that happens over the night.
Exactly, it takes time.
What about Spondylolisthesis?
I know that you love this word and many of the people, they will love it.
I cannot say that. Spondylolisthesis.
Spondylolisthesis.
It's a very, I think I need to hear this word like a million times. It's not many words I cannot say, but this is really...
they are asking me like spondylolisthesis, what is this? And I say, spondylolisthesis.
Okay.
Thing like this. The word basically, it explains what is the problem. It's when like listhesis, just to understand, it means like the slips, something that slips. So not I slip, it's slips.
Okay.
So it's when the vertebra slips forward on the one below. Think like, like it's kind of like slips. Yes. So this usually, we don't see it so often in young people, but there are some certain sports that you can see some stress fractures in the back, that you can see this. Usually it's older people that they have it, and it's degenerative. Just do 1 second to understand this. Think of the discs, the joints, they wear with the time, so they can become looser. And when the things that they hold the bone, they become looser, this slips forward.
So bulges, herniations, stenosis, slips, all changes over time. Not a disaster.
No, it's exactly like all of this. It's normal things that you can find in the reports. Many people, of course, they get panic. And that brings us to one very important point. Your MRI, it's not your horoscope. It doesn't predict your future or decide how much pain you will allow to have. Usually, what MRI is, it's a snapshot of your spine that day that you were lying in the scanner. So it doesn't matter exactly the report or the words if they sound scary. It is what they have scanned that day. The day that you were in the scanner, you were sitting down, how was the structures that day? And because of that, you speak with your doctor, because the scanner, it's one part of the informations. And the other part, it's you, how you feel, your pain, everything. So we treat the person. Yes, not the picture.
So the MRI describes the landscape, but it does not control my life.
No, No.
Tell me.
No, you cannot control the answer in your life. Of course, pain is real, but MRI shows structures. Unfortunately, many people, they are coming even to the private practice and they say, oh, MRI, MRI, MRI. And they don't understand that you as a person and your condition is the most important. The MRI, it's just a scanner. It's one tool that you can use among the others to see. But usually, even when you make the clinical examination, you see, you have an idea about the patient.
So people see disc herniation on a report and think it's permanent. But you said it can improve in week. Please tell me.
Of course, I think like this. The symptoms, they can change faster than the picture, okay? Even the picture maybe will not change or will not change so much. So I think that when you get the pain, usually you have inflammation in that area. And inflammation brings chemical irritation around the nerves. But over the days with their painkillers, anti-inflammation drugs, and of course training, the inflammation settles. So the swelling in the local area can go down, the irritating chemicals, they can reduce or they can go away. And on the nerve that it's irritated, it calms. And even, the body reabsorbs part of the herniated materials. So the disc might never look perfect, but you don't feel your MRI. Like, even if you see your MRI and you see that the disc is like, wow, it doesn't look good, you don't feel the MRI, it's completely different. You feel what the nerve is doing today, tomorrow, in 1 month.
So let's put this short. To see the picture might stay the same, but the irritation goes down.
Yes.
Yes.
Like, you can think it something that many people have it also. It's if you have a sprained ankle, when we make some scan, you can see that the ligament, it looks stretched, okay? But weeks later, even if exists in the MRI, the swelling, the pain are most gone. So for the spine, it's exactly the same.
So I'm not waiting for the disc to just pop back, but I'm waiting for the swollenness to go down.
Exactly. You're waiting the inflammations to settle, to calm down.
What about stenosis or a slip? Those doesn't change, right?
The shape often stays similar. Like, it's difficult to change like the stenosis without an operation, okay? But the symptoms, they may improve. Think that when we say to people you have to train, we get the muscles that they get stronger. People, they can learn positions that gives in the nerves more room. Or even the nervous system becomes less sensitive as the pain and the fear settle. So it adapts. The body has this amazing potential to adapt.
So the brain and my thought, do they really play a role?
Basically, they play a huge role.
Explain.
When we are talking about the brain and the thought, we are speaking about, everything from your sleep, from your stress, from your thoughts, everything. So if you sleep better, you move, you reduce the stress, and the most important, you stop, telling to yourself, oh, I'm ruined, oh, my back hurts. And you trust your movement, the nervous system starts to trust you. So this alarm that screams, I have back pain, for example, I cannot move, it lowers down the volume.
Let's speak about the brain. Why do fear make pain worse? Can you explain how that works?
Yes. I think the brain, basically your brain changes how strong pain feels. And this is very important for people to understand it. If you worry about the movement, the worst case thinking, you have low confidence in your body, stress, or all of these things will make stress. You poor sleep, you don't sleep well, and you are in low mood. All of these they can turn the alarm up. So even if the pain is real, exists, but those factors make the same back feel much worse.
What do we call those patterns?
In medicine, we call them yellow flags. It's like, when you are, we had the red flags, and after we have the yellow flags that they don't help your back or your pain. And some of the red flags, as we mentioned, one of these is like a constant worry about the movement. When the people, they get the back pain, they are like, oh, this will never go better, or I will have it forever. They think like, oh, like what is going on? And after 1 minute again, no, I cannot walk. And after they don't sleep well, they get more stress, they have lower mood, and nothing of this helps, these yellow flags.
So if I'm scared to move, what happens?
When you are scared to move, what you will do? You will tell to your body, okay, go into protection mode. And the body tightened, so all the muscles will be like expelled. So you avoid positions, and what you do? You don't move. You do less movement. In short terms, maybe, okay, you are sitting in your couch watching Netflix. This it's okay, but in long term, your back gets only stiffer and weaker. And of course, more sensitive. Because when you after want to make the movement, you don't feel safe and you have the stiffness and it feels worse. So the most important thing is to have a gradual exposure. Like start small, build slowly, teach your system like, okay, the movement is okay, I can move, it's not a problem, I will not break.
What about the people that have thoughts like this pain will never go away?
Those thoughts, what you will create is that you will increase the stress and the tension in your body. And when we increase the stress and the tension, what your brain will do, it will pay more attention to every signal from your back. Like the alarm feels louder and I'm sitting here and I'm waiting like the brain
for the pain.
Yes, now it's coming the pain, now it came the pain. So the most important is to catch those thoughts and replace them with something calmer and with something that will be helpful.
What about not trusting my back at all?
This is also very common.
Same.
Yes, because you feel like fragile. Yeah? You stop doing normal things that you were doing until yesterday or in the morning. And you concentrate most in your pain. And the pain hangs around with you and you are just sitting there and have the same thought.
Makes sense. I want to ask about mood. How does that affect the pain?
Things like this. The mood affects the pain and the pain affects the mood. It's like both ways. If you have low mood, you lower your pain threshold. And when you have a pain, it pulls your mood down. So it's usually both ways.
What about the stress?
The same, like you have the constant stress that keeps the nervous system on, and it's exactly the same thing, because you can have stress because of other things, or you can have stress because of your thought of your back. So either way, you are in a stress mode. And in the stress mode, usually you're running on adrenaline. And when the back pain hits you in all of this, it will feel like much bigger, higher stress. So it will just make worse the pain.
What about if you carry a trauma from the past? Does that change anything?
Yes, it changes. When we are talking about like past trauma, it can be physical or emotional, and this is very important. Because you cannot say that it was only physical or emotional, it can be both, or it can be even emotional trauma. If you see what's happened when you have the emotional trauma, for example, the physical, your nervous system, it's more sensitive. So it's like your nervous system learned to stay on the high alert. So even if the pain is completely real, we know it, those people, they are already in alert stress, so the body, it feels it more. It's exactly the same thing with the thoughts or with the stress, because the stress doesn't matter the cause of the stress, it's the same, you have the same results. And especially people with, physical or emotional past trauma, it's good to speak with a therapist.
How about does the everyday life actually matters for the back pain?
When we're talking about everyday life, we are talking about probably the habits that everybody has, okay? So the habits that you have, they don't usually cause a flare alone, but they can push the things in the wrong direction or in the correct direction, depends of the habits.
Like what?
Typically, as every doctor says, it's smoking. Smoking is linked also to more back pain, and because it flares up. And why this? Because smoking, it affects also the blood flow and the tissue quality. So for people that they have back pains and they are smoking, if you think it's like quitting, it's not just for the lungs or for the heart, it's also for the spine health, basically for all the body and the tissue health, but we are talking about the spine right now.
What about the weight?
We know that higher body weights, it's linked to more back pain. This is, we know it. But what matters is that we have to focus on what we can do for the people that they have higher body weight, not about the weight or the number of the weight. So it's very important to see, okay, we have someone that is overweighted, okay, what we can do today, how we can start mobilizing, okay, how we will put that person to move, how we can how we can make this person to understand, to have less fear and to see the progress. And of course, if we manage to have nutritional changes, that's great. But you cannot change the number on the scale. You have to build the trust in those people to move. This is the most important.
And work?
Work, it's exactly the same like stress. When you have a high workload, for example, surgery, like I get a lot of pain, especially after the operation. But when you have a high workload and you have sometimes low control in your work or low support, all of those things are linked with back pain. And what is good to explain to people is that people that they are not happy in their work, they have also slower recovery.
Does social support help, and how important is that?
Social support, it helps. Okay, it will not fix you the damage, or it will not make the pain to feel less, but it can feel lighter because you talk, you communicate, you move, you take your friend, you say, okay, Len, I have pain today, please can we go out to walk? So the pain is there, but you feel it lighter. And it's very important to talk with people that we know or with the close people to us or family, even the day that we have pain, it makes it lighter.
And the last question, how does MRI report make the pain worse?
The MRI report makes the pain worse in the same way as the stress. What happens? I have seen many people that they get the MRI reports in their hands, and some other people that they read them, and some other people we are sitting there and we explain them. So when you get your MRI report, most of the people, they don't understand like degeneration, like bulging. Usually they write all these strange medical words where, everybody's like, oh, what is this? I'm falling apart,
They go to Google.
Yeah, if they go to Google and then you start to Google, it's not so good because Google explains very well, but
It doesn't fit always.
No. So think about they give the fear, I'm falling apart. So when they get the fear, what happens with the alarm? The alarm goes
Get worse.
Yes, you get stress, and after you get panic, and the cycle starts again and goes on and on. It's like, so don't focus in the MRI. Speak with your doctor to get some explanation.
If I put a question like this, how often do people actually need a surgery?
Less often than you think, or less often than all the people think. Officially, we say around 90% or even more of back pain is treated successfully without surgery. Rehabilitation and painkillers. In very large populations, because many researchers are in large populations, so in the USA or in Europe, we know that around 10% of the back pain patients will eventually have a surgery. Now it's the tricky part that in this 10%, it includes people with severe or specific problems. So, surgery works for specific situations, but most people listening probably aren't in that pathway.
I feel flattered that I'm one of the 10% that had a surgery, but I have to say I'm feeling very well right now, thank God.
Yes, but you have to mention that you are training almost every day, so you have your schedule, you have your diet, and you have your training. And it took time.
Of course. It was not an easy way, but work hard and you get there. But good to know all of this. Now let's get to the plan.
Okay. The plan will give 3 levers that you can start within this week or when the pain starts. The number 1 is very important how you think about the pain. The number 2, it's how you sleep. And the number 3, it's how you move.
So mind, sleep, movement, simple. Let's break them down. Explain.
Okay, we can make the reset the story.
Yeah, reset the story.
Okay, first you have to, the most important thing is how people thinking around their back when it comes to the back pain. My back is broken, or if it hurts if I make this movement, if I make this movement, it can be worse. And that keeps them scared and stuck. So there you have, to take your time 2-3 times per day and to replace those thoughts. Like, okay, this hurts, I have pain, but I'm not damaged. It's the most important first step is the thought. Like, you're thinking positive, after stand up or walk for a minute, gentle movements, this action will prove to yourself, of course, and to your brain that this is good. You see, I can move. It's not exactly what I'm thinking.
So catch the panic, switch the sentence, then move to prove it.
Yes, exactly. You change your thoughts and you make an action.
What about sleep?
Sleep, as everybody knows about sleep and everybody speaks about sleep.
Which we as parents never get, but...
No. Okay, sleep is very important. Okay, we know this. You have to sleep at least 7 to 8 hours. And this is, again, very important. I don't know who finds this time.
Can you prescribe something to me as a mother of 2?
That the children, they will not wake up.
Exactly.
You can sleep many hours, but the children, they don't let you. No, but the only thing that you can do is like pick a time that you know that you go to bed, okay? For example, 11. I go every night 11 and try to get up at the same time in the morning. It's very important. There are coming also studies that they show this. Mm-hmm. It's very important the same time, every day, same time to go to sleep and same time to wake up. Okay? And those days that you have, the pain, don't stay in your phone and, leave it outside. Don't stay there. Start looking people that they don't have pain and it makes you more sad. Or see people that they are training and you think, no, I will never train again. Or you are sitting there and you Google my symptoms or what my MRI report says, and you get more stress. So, and speak to your doctor to get your painkillers because it's very important to sleep.
Does bad sleep make the pain worse?
Of course, because you have, again, two things here. One is that the pain disrupts the sleep.
So,
And one more thing, like the poor sleep amplifies the pain. So it's like a circle. You have to fix both.
yeah, so better sleep makes the tomorrow day more manageable, of course.
Exactly.
What about the movement?
The movement, it's also the third part that it's also important. And usually you start with, gentle movements, gentle low. You don't want now to go to the gym to have a hero training today. So you start with simple things. You pick one or two simple movements that you trust. Sitting to standing, where you can have like small hip rock, push-up walls, something that you can do slowly and in a safe range. And always after, pair it with walking. So you see, I have done this movement, I don't feel so much pain, it works, now I can go 10 to 20 minutes walking. Like shorter walks.
So if my back feels rough, it's better to train 5 minutes than just to skip the training.
Yes. You think you will train and you adjust the dose. You don't abandon the plan. It's very important to adjust.
Yes. Can we give people a simple template?
Yes. Think it as a core and calm. Okay? So, before you start, you take 1-2 minutes just to slower breathing, to settle down the system. A simple core pattern that you already know. Okay, for example, the dead bug. Or gently bracing you can use. And usually you can make a side support pattern, like I can make a little side plank on knees, a small hip hinge or a sit to stand. And after I go 10 minutes, 20 minutes, or even more to walk. Mini walks through the day, like you continue walking.
A common question. How do I know if I train too much or if I'm doing too much?
You can use a very safe rule, the traffic light.
Explain.
You have the green, the yellow, and the red. Okay? So when you have the green, the pain, we can say that it will be from 0 to 3 out of 10. Okay? During and after the movement. Okay? So that means that, well, that's fine. You can have the yellow, the pain can be to 4 to 6 in the scale. So here you make smaller movements, fewer reps, shorten walk. And
makes sense.
Yes, it should settle around the day and you check it again. And you have the red, but usually in the red it's very difficult to move. Many people that they feel the pain around 7 to 10, it's very difficult to move, and especially when the pain travels further down to the leg. So there you stop exercising, but for us we suggest, like a doctor, you should go to walk, or you should come up and to make small movements. And of course the key in all of this is to modify your movements. You don't stop all the activity.
What do you want to say to the people that work in the office, that sit behind the desk a whole day?
Here again you can use the rules of 3. Stand up every 30 minutes for about a minute. And when you stand, you change position, you can roll a little bit your shoulders. Maybe you can have a couple gentle movements. And if, of course, if the job allows, you can take a call or a meeting into a walk and talk. Like small breaks, which will reduce the stiffness. This is very important.
Should we have a Q&A?
Yes. Shoot me with your questions. Start when you're ready.
Are you ready for a Q&A? Okay, we're gonna have a question that is also very common. Usually I get the question, today I bent down to pick up my child or to lift something and something suddenly snatched in my back. Did I break something?
No. Usually this heart pain that we feel, it's coming from a muscle spasm or a joint irritation. It's not like a structural damage. The movement, usually it's the trigger, but the back was already sensitized from days or weeks before. No, sitting, stress, poor sleep. So, no, don't break something.
Should I rest or be in bed until the pain goes away?
No rest.
Never.
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 Bed rest, things like this, if you have a severe pain, bed rest beyond 1 to 2 days actually make things worse, okay? Because as we said before, your back can get stiffer and weaker. So move gently, or even if it hurts, move. And this is again how you teach your system that it's safe to move.
Okay, let's jump to another question. Which I also get at times at the gym when I meet people with different type of pains. Many people knows I had a back surgery, and people that suffers from disc or stenosis or whatever, they ask me, do you think it's worth it to have a surgery? But it's not like my place to comment. What would you like to say about those questions when people ask a random question?
First of all, the people that ask, they should understand that your friend's back is not your back. Their MRI, it's not your MRI. Their pain story, it's not your pain story. Surgery, it works.
Yes.
Okay, for specific problems. For example, you have severe nerve compression that isn't improving after weeks of rehabilitation. It's everything, it's individual. Okay?
Of course.
So what works for you or for a friend maybe doesn't work for you. Or what I need, maybe it's not the same that you need. So everything is individual. We treat the patient and not your friend's outcome or their friend's outcome. Okay?
Yes, I totally agree with you. What about if this pain goes longer than 3 months? Does that mean it's chronic, or are they stuck with the pain forever?
No, it's not chronic. 3 months doesn't mean permanent pain. It means that you need a structural plan and probably some help from the physiotherapist. Okay? Chronic just means lasting a while. It doesn't mean, unfixable. People improve at 3 months, 6 months, 12 months, or even years later. So we don't have, a time limit. The most important is to rehabilitate, to move, and to understand the cause and how the back pain works.
And the last question, is it dangerous, or can I still go to the gym, or should I just cancel my membership to freeze my cards?
You specifically, it's impossible to cancel your membership.
Never.
But yes, so
I'd rather have a second surgery than to...
I'm sorry about that. So think like this. Of course, you have to move. Okay? So there is no question. Keep your membership. Just modify it.
Yes.
Use a lighter weights, avoid exercise that spikes your pain in the back. And very important, focus and control movements. And the gym, it's not your enemy. It's
The best friend.
Yes, but so what is bad dosing is your enemy. Like what the bad movement is your enemy. To don't have control of your movement is your enemy. And to don't move is also your enemy.
All right, so let's wrap this up. What do people need to remember that is worth mentioning?
Okay, we'll make a summary. lower back pain is biopsychosocial. The most important is to rule out the red flags and to rebuild with activity, sleep, and confidence in your body. Images, they are important for diagnosis, but it doesn't change the pain or the recovery. And very important, surgery is exception, not the rule.
So don't panic. One helpful sentence, one better bedtime, one short walk is better than nothing.
Exactly. And we can give like 3 levers for this week.
Sure.
As you said, first, reset the story twice, 3 times per day. Okay? Upgrade your sleep every night. Move and walk most of the days. And those levers are for everybody, not for those that they have pain.
And we want to hear how it goes for you. What worked and what didn't.
And if you have tried everything and nothing worked, you can find us.
And we are GNL, and we believe structure is luxury. What do you say?
Thank you very much. See you next time.